From an average daily count of 78 cases in Metro Manila, OCTA Research has noted a 10% increase in infections to 86 cases daily. That covers the first week of June. Positivity rate in the region also rose to 1.6 from 1.5.
It's a slow increase, but it's still an increase in the positivity rate. So there could be something there that we're not seeing, and that's why we're monitoring the numbers.
But for the health department, the increase is not yet a cause for concern, especially with hospital occupancy remaining low.
Pag ina-analyze namin ang mga numero at saka mga datos, nakikita natin mga less than 10 or less than 20 cases lang ang naitatala na pagtaas. Siyempre kapag sa positivity or sa growth rate natin titignan, talagang minsan tumataas because mababa ang pinanggagalingan na numero.
10 more cases of the new Omicron subvariants have been recorded in the country. 7 cases were BA.2.12.1, while the other 3 were tagged as a BA.5. 2 of the BA.5 cases are from Calabarzon. The remaining case is still being verified. The DOH has earlier confirmed the local transmission of the 2 subvariants.
We can say na wala tayong mga international sources for BA.5. But we still need further evidence for us to be able to confirm really the status of transmission here in our country, especially for these subvariants.
Vergeire, however, clarified that the slight uptick in cases is not directly related to the entry of these new Omicron subvariants. She also reminded the public to get their booster jabs and follow health protocols.
Upang hindi na ito patuloy pang tumaas at upang manatili tayo sa low risk, patuloy po tayong sumunod sa minimum public health standards at magpabakuna na at magpa-booster sa lalong madaling panahon.
For News 5, Camille Samonte, We Are One News.
Could the uptick in cases warn of a possible surge? That big question and more with OCTA Research Fellow Dr. Guido David. Dr. Guido, welcome back to the big story.
Yes, good evening, Robbie.
Yes, Dr. David, we keep referring to it as an uptick. Does it necessarily signify that this is a trend or that a surge is coming?
Well, that's possible because we have seen this uptick in the past 3 weeks, meaning we have seen a positive growth rate for the past 3 weeks in Metro Manila, though the growth rate has been very small, around 10% on average. So it has been increasing by 10% every week. This is in itself not a cause for concern. And if it just continues this way, we should not really have any problems with the management. But there's some concern that this may start to accelerate. We don't know that yet. If it does start to accelerate, the cases will be a bit higher than what we're seeing right now.
Yeah, a bit higher it must be, given especially that not many people are bothering to take their test and ride out the milder symptoms. But given precisely that we're not necessarily seeing results of all the tests, by how much could we be underestimating the real figures?
Well, normally, Robbie, we could be underestimating by as much as, it could be up to 10 times higher than what the numbers are showing. I mean, we have seen this in the past. And I agree, the number of tests is low. In fact, Metro Manila is testing less than 10,000 per day right now. During the peak of the surge, we were testing as much as almost 50,000 per day in Metro Manila alone. And in fact, Metro Manila is one of the areas where the testing is actually higher, because in many provinces they're not testing even close to a small percent of that. So there's definitely under testing in many provinces.
Is this tied more to any of the subvariants, or is this tied more to people not taking their boosters?
Well, I think it could be a confluence of factors, Robbie. One would be complacency, and then increased activity. We're not saying that we should limit movement or economic activity, because we have had that over the past several months and we haven't seen a real increase in cases. The other factors would be the presence of the new subvariants and, of course, waning immunity, which is It's likely to be happening around this time because 3 to 4 months have passed since most people were vaccinated and most people were exposed. So it could be any or a combination of those factors that is causing the uptick. But so far, the wall of immunity is still holding. That's the good news, but we're not sure if it will continue to hold.
Okay, Dr. David, maraming salamat po. That was Guido David of OCTA Research.